초콜릿은 달콤해 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 오렌지는 상큼해 상큼해 상큼해.
Good day, this is Ms. Katipay, a student nurse from Foundation University BSN1, and for today, I will be assessing the musculoskeletal system of my client. Before doing the assessment, make sure that you check all the equipments needed prior entering the room. Knock the door. To do hand hygiene, use this alcohol to sanitize your hands. Provide adequate lighting and privacy. So good day, sir. I am Ms. Katipa, your student nurse for today. And what I am going to do, sir, is to assess your musculoskeletal system. So first, may I know your name, sir? Okay. Your last name, apelyido mo, sir? Okay. Your age? 30. Okay. So, sir, I am going to perform this assessment to know if there is any dysfunction or abnormalities in your musculoskeletal system, because it is important, because it tackles or it entails the condition of your muscles and joints. So would you like to empty your bladder, sir? Manahan pa ka nga manghihi sa o sa mo perform sa assessment? Okay. So, sir, first that we are going to assess is your posture, your gait, and your cerebral function. So, now let us start assessing your posture. You may now stand, sir. His posture is straight and in good condition. And now let the patient. So, our patient has no signs of gordosis. And now let our patient position like he is tying his shoelace. Okay, our patient has no signs of scoliosis. The next is we are going to let the patient walk. So, sir, can you walk like your normal walk? Okay. One more time, sir. Okay, the patient's gait is normal. His arms and legs are fully coordinated. So next is we are going to the deviation of our patient, which we are going to use the tape measure. Okay, so deviation is good. So now let us proceed to the Romberg testing. So what we are going to do is we need to let our patient close his eyes. Then we are going to position herself in a strong mode. Then we are going to do like this. Okay, sir. Okay, so it's good. Our patient is negative on Romberg test. So, sir, next that we are going to perform is the rapid alternating movement. So, you need to be aware of this following movement: the crenation, which is the dorsal surface of the hand. Follow me, sir. And the supination. Crenation and supination. So what you're going to do, sir, is whenever I say crenation, you will do like this. Whenever I say crenation, you're going to do like this. Okay, sir? Okay, so next is you're going to tap it in your lap. Okay, that's good, sir. Next is we're going to do the finger thumb. So you're going to do this, sir. Like this. Okay, it's good. You can do it. And next, we're going to use our pointing finger. And what we're going to do, sir, you need to face here. You need to face here. And then whenever I do this, you need to put your fingers here. Then this, in a faster motion. Okay, it's good. Our patient has no any problem with the assessment that we are doing. So now, I'm going to inspect your muscles, sir. See the color, the size, the symmetry, if there is lesions, tenderness in muscles, and many more. So first is I'm going to inspect your color. This color is dark brown. And your symmetry, Your symmetry is good. It is aligned, but to be exact, let us measure it using our tape measure your lower limb and your upper limbs. Okay, let us start here and down to the middle finger of the tip of the middle finger of our patient. So it's 70, sir. So please be reminded of the measurement, 70. And to the other side, from here to the tip of the middle finger. So here it is 71. So again, it is still normal because it has only a difference of 1. So next is the lower limb. So again, there's also a difference of 1 centimeter against, but it's still normal. Okay, so now let us ask the patient or the client some questions so that we can assess his musculoskeletal system. So sir, first question is, have you have any history of musculoskeletal diseases or dysfunctions like scoliosis, gordosis, and many more?
No.
Okay, no. So how about your parents and grandparents?
No.
Your lolo, lola, nabi sila katuri sa like gihiwi sila like scoliosis?
No.
Okay. So next is, are you experiencing pain right now? Sir, naka-feel ba ka kanay murag pamaol or sakit sa imong lawas karon?
No.
Okay, no. How about accident and trauma, sir? Have you experienced it? Like na disgrasya ka, then you are traumatized?
No.
Na depressed? Okay. So how about immunization, sir, of anti-tetanus, like anti-polio? Humana ba ka ani, sir?
No.
Okay. So you need to be immunized by these two, the anti-tetanus and anti-polio, so that you will be protected by any musculoskeletal dysfunction. So next, so are you allergic of dairy products, sir?
No.
Okay. So what activities you are doing, sir, to improve your musculoskeletal, like exercise, like sports? Unsa imong sports, sir, na permi nimo ginadula?
Basketball.
So how often, sir, like kapilas us kasi mana ka na magdula og basketball? Sige.
No.
Okay. So, are you wearing protective equipment, sir? Like sapatos, like knee pad, kanang para malayo ka sa mga injury?
No.
Because we are protecting our musculoskeletal.
No.
No? So, kailangan dyan, sir, na magsuot ka og sapatos, knee pad, or unso ba na pwede mo protect sa iyong labas. So, sir, now I will be palpating your muscle to know if there is tenderness or any other dysfunction. So, in performing palpation, okay, the muscle of our patient is soft and non-tender. So, now we let us proceed to the lower limb. And next is we are going to proceed to the contracted state. So, in contracted state, we should let the patient, like mangusog sila, para makita na to ang sa ilang muscle for the contracted state. Okay, we need to let our patient do this one. Sir, mangusog. So this is the contracted site for patient. Mangusog, sir. Next here to the lower limb. Okay. So the patient's in contracted site, our patient muscle is firm but non-tender. So next, we're going to perform the heel walk, the two walk, and the tandem walk. So first is we're going to do the tandem walk, in which you're going to align your feet while walking your regular or normal walking, but you need to align it. This is how to do tandem walk. So now let us let our patient do the tandem walk. Now sir, perform the heel walk. You'll be using your heel to walk. Next is you're going to do your two walk. Go. Okay. So sir, next is we'll be checking for your cranial nerve 5, which is the trigeminal, and your cranial nerve 11, which is your spinal and sensory nerve. So first thing you're going to do, sir, is you need to stand, open and close your mouth. Okay, one more. One more. One more. One more. Okay. Next is I'm going to be at your back, then follow the instruction that I will be giving. So next, sir, this is to measure the muscle strength of our client. So we need to let our client mausog and do as what I say. So you need to raise your shoulder. Okay, good. Next is we're going to inspect her sternocleidomastoid. You need to mausog atong patient. Okay, it's good. It's in the norm. So next is to palpate our patient's muscle. So we need to check for any skin trigger. Next is for the capillary refill. Okay, good. Next is we are going to do or inspect the range of motion from. So next is first is we are going to check if there is nodules or masses around his upper and lower limb. Next is we are going to inspect if there is edema. So after, we need to let our patient or client flex his neck. So sir, can you flex his neck? Okay, the finding is normal. Next is we're going to do the rotational lateral bending. So next is we're going to do the rotational lateral bending, which we're going to let our patient relax his shoulders with arms on the side. And next we're going to let the patient bend his neck like this. Okay, so next is we're going to rotate your neck. Okay, it's good. Next is we are going to test the range of motion for the shoulder of our patient, which we are going to let his arm up, then down, then hyperextend. Okay, sir, perform that one more time. Okay, sir, did it. Okay, next is we are going to on the shoulders abduction and adduction. So in performing that, we need to let her patient arms at the side, up, then at the front. Okay. Sakit, sir, dili. Okay, next is we're going to perform the external and internal rotation. So first we're going to perform the internal rotation. And are you familiar with this? We're going to do this. Okay, next is we're going to perform the external rotation. Okay? Sakit gamay. Okay, our patient has a little pain for the assessment. Okay, thank you, sir. Next is we are going to perform for the full range of motion, or the range of motion I mean for the elbow. So we are going to present. We need to let our clients hold their strength and do this one. Okay, next is we are going to the ROM of our forearm. This is the subination and the crumation. The crumation, the subination, crumation, and subination. So do it yourself, sir. Crumation, subination, crumation, and subination, 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 crunation. Okay, good. And now let us proceed to the wrist. We're going to perform like this, but you need to hold this strength. Also, good. Pangus sige. Pangus sige, sir. Kami kinapos ka mo. Suka. Okay, it's good. It's now. Let us proceed to, that is the abduction and adduction. Let us proceed to the adduction and adduction, which we're going to perform like this. Okay, our patient has full range of motion for the performance of abduction and adduction. Next is the assessment of the finger and thumbs. Our patient will do this. The pointing finger should be doing flexion and extension. Okay, sir? You know the flexion and extension? Okay. Okay, good. So you need to. Next is simultaneously do this with your 4 fingers. Okay, the flexion and extension. Okay, next is your thumb. Need to open your palm, which is a palmar surface, and do this one. Then at your dorsal surface. Good. Okay, sir. Next is for the opposition, which the thumb would be paired with the different fingers in your area, like this. Okay. Okay, good. So now let us proceed to the assessment of the range of motion for our hips, knees, and toes. So now let us start with this. You need to put your thumb on your hip. Okay, do it yourself, then the other side. Next we're going to do now is to let this here now and then the other side and vice versa. Okay, this is how to do it. Pumo ka, sir. Then side. Okay, good. So now let us proceed. So now let us proceed to the ankle when he will be going to do this one. Move. Okay, that one. Okay, do that one, sir. Okay. Next. Okay. So next is you're going to perform this, and then, but you need to hold your strength. Mahusog ka. Okay, thank you. Next is we are going to let the patient be in the dorsal position. We need to let the patient hold their strength. Like do this one. Then on the other side. Okay, do it yourself, sir. You have that full range of motion. Next is we're going to test for the muscle resistance of our client. We should let them hold his strength. Like this. Okay, then the patient will do this to me as well. Okay, it's good. Now, let us go back again and let us test for the muscle or the resistance of the ankle. So we need to push the muscle when the ankle is. Do this one. Mangusog ang atong client. Go. Okay. Okay. And now we are going to check for reflex. If gilkan ba atong client using this. The direction should be from lower to upper. Okay, we need to ask our client if nagilkan ba siya so we can see that there's really reflex. Okay, gilok, sir.
No.
Gilok dere. Yes. Okay, so the procedure is done. The assessment of the musculoskeletal is done, and I hope you learned something from the video. So to summarize it all, I already documented my findings if there is abnormalities or all are normal. And as I can see for the range of motion, our client has the full range of motion, and I don't see any new lesions, tenderness, or any not symmetrical on the musculoskeletal, or I cannot see any musculoskeletal dysfunctions in him. So I hope you learned from the video and enjoy it as well.